Seizures, never feed a patient during active seizures. There is a misconception about feeding and active seizures. I will tell you in this video. Hi, I am Dr. Biswajit Sengupta, practicing neurosurgery consultant from Apollo Multispeciality Hospitals. Seizures is a common myth that when a patient is seizures, after that you feed the patient with hot milk or any hot drinks, which is a wrong concept. Actually, when the patient is actively having the seizures, there is a high risk of swallowing the food and it can come into the windpipe or the respiratory tract, which can cause breathing difficulty. The first and the foremost thing when a patient is having seizures, the relatives or the bystander should do is to turn the patient to one side so that the patient, when he is unconscious, the secretions can come out of the mouth and not go into the windpipe and cause aspiration. This is the first and foremost step everybody should know, including the family members of the patient, those who have seizures. Next, once the seizure is occurring for the first times, and if there is even a family history, irrespective of age group, the patient should be taken to the nearest hospital to consult a doctor regarding evaluation of seizures, because timely evaluation and intervention goes a long way in early detection, preventing the brain damage and curing the patient. So the false concept, the old concept should be discouraged, that people with seizures should be fed once they come back to consciousness. They should not be fed because they remain drowsy for a certain period of time, and that can cause more harm than benefit. So the patient should be taken as early as possible to the hospital for a detailed neurological evaluation by either a neurosurgeon or a neurologist. And with present medications, most of the seizures are controllable. And whenever the patient who has got seizures, if there are seizures and the patient has been under follow-up, there is no need to panic. The first aid the patient family should do when the patient is having seizures is to turn the patient to one side so the patient does not swallow his own or his, her or her own secretions, and the airway is protected. Sometimes the seizures can continue beyond 2 or 3 minutes, and this can cause lot of brain damage. So in this case, the patient should ring up the treating doctor if one is available, and then arrange for any self-medication. With present day, we have lot of spray which can be sprayed into nose to abort or stop the immediate attack of the seizures and prevent the brain harm. And then the patient should be taken in an ambulance with oxygen support, because with ongoing seizure there is a lot of hypoxic damage to the brain. So any patient who is having seizures beyond 2 to 3 minutes continuously is known as a patient who is in status. So this patient should be immediately taken to the hospital for better treatment. There are multiple causes of treatment, there are multiple causes of seizures depending upon the age group. Like in elderly, if a patient who is past 40 or 50 and having seizures for the first time, the initial evaluation is a cranial imaging, because the patients can have an underlying brain as well, which may be the cause of seizures. While in young patients there are congenital brain developmental anomalies which can cause seizures. But all seizures with timely detection and intervention and with present anti-epileptics, wide range of anti-epileptics, in most of the cases the seizures are treatable and the outcome is good. So if there is a seizures, do not panic. Put the patient in a lateral position, right lateral or left lateral, which is there. Do not try to immediately feed the patient when the patient comes back to his normal level of consciousness. And depending upon the duration of the seizures, whether it is a first attack or a repeated attack or under follow-up, you have to give the treatment accordingly. And if the patient, and all the things that need to be done for a patient who is having seizures is never miss a dose of the anti-epileptics. With all these basic steps, one can go a long way for the treatment of seizures and successful treatment of seizures. Thank you.